Could you also touch on the difference between, let's say, the Canadian healthcare system and the United States healthcare system, and your thoughts on that?
Yeah, so the Canadian healthcare system, single payer system, so basically provincially or what's federally funded, provincially regulated. U.S. a little bit different, private. There's also like Medicare and these sort of things where there are some government assistance. I think the one very nice thing about Canadian healthcare is that the education system is quite standardized, right? When we think about medical schools, when we think about residencies, and so forth, you know what you're going to get, right? Across the country. And it could also be because we're a smaller country, like we know all the urologists in the country pretty much just because it's such a small group. But I think it's because all the training programs are pretty well regulated. So I think that's one nice thing here. The US, a little bit different. You're going to have the top tier, and then you're going to have everything in the low tier, and you have everything in between.
Yeah.
So sometimes you don't know what you're going to get. But I think the one very nice thing about the US is that you can get access to care quite quickly, right? So it's very not too difficult to see specialists and get seen in the emergency department down in the US. It's more costly.
Yeah.
Here, trouble is wait times, as we're kind of seeing. Wait times are just getting higher and higher and higher. And so that's the one challenge with the Canadian healthcare system. And that's kind of why we built this place as well, is that we have an operating room here. So we've been doing a lot of procedures here to take them out of the kind of the major hospitals. I think the one challenge between the Canadians' healthcare system versus the US is that we don't have enough doctors and nurses here. I think that's also an issue down in the U.S. as well, but it's a clear shortage right now. And as the population continues to grow, we just need more healthcare professionals.
Why do you think that is?
I think it just probably outpaced it. Whether it's a limited medical school seats, it's always just been stagnant potentially, right? Now that there's more schools opening up, more seats being available, but then with that needs to come more the end line. You can't hire more surgeons if there's no more operating rooms, right? Or you can hire as many as you want, but if you don't have enough resources to support them, how's that going to work? So it kind of has to all come in tandem. Is that you kind of have to think about it all throughout, and so that's ideally the way things are going. But the other aspect is you kind of want to use facilities appropriately as well. When you have a limited amount of dollars, you don't want to use very expensive resources.
True.
For not very invasive procedures, right? So that's where we've been doing is a lot of procedures here to take them out of the hospital, try to shift the focus out of the major hospitals to smaller operating rooms where you can do these procedures safely, using them more effectively for the bigger procedures. So it's we'll see how the future goes. Clearly, there's a lot of eyes on healthcare right now.
Of course.
But my firm belief would be to stick with a government-funded healthcare as opposed to what we're seeing down in the States.
Do you think the issue will ever get resolved? Will there ever be a system where you don't have to wait?
I think you're always gonna have to wait. I guess it depends on what is the reasonable wait time, right? I think the ideal goal people say is that you should be able to get a second opinion very quickly. Right now we just need to get a first opinion, right? So I think maybe in the future once we have a way, but we have to start thinking things a little bit differently. And the other aspect just has to come with education, right? Like patients need to be educated before they come in through the doors. Because what if they have something that they're not concerned about or they don't know, right? So what we try to do here especially is that we try to pre-educate patients as much as possible. So we send them, we create YouTube channel, YouTube videos, brochures, anything, because the more educated they come in, maybe they will be able to make their decision based on what they want at that appointment, as opposed to, say if I see someone for the first time, we're talking about their condition, say you're talking about the erectile dysfunction. It's like, okay, I need some time to think about all the different treatment options. Okay, I'll see you back.
Oh.
Well, that second appointment could have been for someone else. I could have treated that person on the first one.
Yeah.
It may not go that way, but if you're trying to make things as efficient as possible when you have a lot of patients to be seen, so there has to be smarter ways of delivering care.
So do you feel like social media is having a play on that aspect of, delivering the education right away? Or do you think social media is kind of oversaturating the market with what the client receives?
Yeah, again, great question. So a study we did here too about misconceptions in sexual health. I think some patients in our survey, our patients found that it was very confusing, too much information out there. So that's why we elected to create our own content. Because again, when they see us, they're going to be comfortable with what we send them. The other nice thing is that once you make a YouTube educational video, for me talking to them already on a YouTube video about their condition and then seeing them, it already starts building that pre-trust in it. That they're like, okay, this guy sounds like he knows what he's talking about, right? So I think that is